is a medical condition in which tissue similar to the lining inside the uterus, called the endometrium, begins to grow outside the uterus. In a typical menstrual cycle, estrogen plays a crucial role in preparing the uterus for potential pregnancy. During the first half of the cycle, estrogen levels rise, stimulating the thickening of the endometrium. This thickened lining is essential for nourishing a fertilized egg if conception occurs. If pregnancy does not happen, estrogen levels decrease, leading to the shedding of the endometrial lining through menstruation. However, in endometriosis, the endometrial tissue starts growing in places outside the uterus, such as on the ovaries, fallopian tubes, intestines, and bladder. In some cases, it can even affect areas beyond the pelvic region, such as the diaphragm or surgical scars. As estrogen levels rise, this ectopic endometrial tissue thickens and breaks down, just like the normal endometrium inside the uterus. However, unlike menstrual blood, the blood and tissue from these ectopic sites have no way to escape. As the ectopic endometrial tissue grows and sheds repeatedly, it triggers a chronic inflammatory response. This prolonged inflammation can lead to the formation of scar tissue. This scar tissue then turns into adhesions, which are bands of scar tissue that cause different pelvic structures, such as the ovaries and fallopian tubes, to stick together. In some cases, endometriosis leads to the development of endometriomas, which are cysts filled with dark, old blood. These are commonly referred to as chocolate cysts due to their thick, brown fluid. These complications can cause significant pain. In some cases, adhesions can distort the anatomy of the reproductive organs, interfering with the egg's ability to travel from the ovary to the uterus, which can lead to infertility. In more severe cases, adhesions can cause organs to become twisted or displaced, potentially leading to complications such as bowel obstruction or urinary issues. The exact cause of endometriosis is still not completely understood. The most accepted theory is retrograde menstruation, where menstrual blood flows backward into the pelvic cavity instead of leaving the body. Treatment options include pain management, hormone therapy to suppress estrogen, and surgical intervention to remove endometriosis tissues and adhesions. Thank you for watching this video. If you want to learn more about gynecology, you might want to have a look at my playlist to watch all the videos on this topic.